Brief anger can temporarily impair blood vessel function, potentially heightening heart disease and stroke risks, finds new study in the Journal of the American Heart Association. When adults became angry after remembering past experiences, the function of cells lining the blood vessels was negatively impaired, which may restrict blood flow. Research has found that this may increase the risk of heart disease and stroke. A brief episode of anger triggered by remembering past experiences may negatively impact the blood vessel's ability to relax, which is essential for proper blood flow. Impairment of blood vessels' ability to relax, as found in the study, can indeed increase the risk of developing atherosclerosis. Atherosclerosis is a condition where plaque builds up inside the arteries, narrowing and hardening them. This narrowing can restrict blood flow and lead to various cardiovascular issues, including heart disease and stroke. Therefore, the impaired ability of blood vessels to relax, caused by brief episodes of anger in this case, can contribute to the development of atherosclerosis and subsequently increase the risk of heart disease and stroke. The most common negative emotion studied is anger, and there are fewer studies on anxiety and sadness, which have also been linked to heart attack risk. The study investigated the impact of negative emotions, anger, sadness, and anxiety on blood vessel function compared to a neutral emotion. The 280 adult participants were randomly assigned to recall a memory that made them angry, anxious, or sad, or to engage in a neutral task for 8 minutes. The researchers assessed the cells lining the participants' blood vessels before and after the tasks, looking for signs of impaired blood vessel dilation, increased cell injury, or reduced cell repair capacity. Measurements were taken at baseline, 0 minutes, and at 4 different time points after the emotional tasks: 3 minutes, 40 minutes, 70 minutes, and 100 minutes. The analysis revealed that recalling past events causing anger led to an impairment in blood vessel dilation, which lasted from 0 to 40 minutes after the task. However, this impairment was no longer present after the 40-minute mark. Interestingly, there were no statistically significant changes in blood vessel linings after the anxiety and sadness tasks, suggesting that these emotions may not have the same immediate impact on blood vessel function as anger does. Researchers highlighted that evoking an angered state led to blood vessel dysfunction, but the exact causes of these changes are not yet fully understood. Investigating the links between anger and blood vessel dysfunction could help identify intervention targets for those at increased risk of cardiovascular events. It was noted that this study adds to the growing evidence that mental well-being can affect cardiovascular health. Intense acute emotional states, such as anger or stress, may lead to cardiovascular events. This study demonstrates how anger can negatively impact vascular endothelial health and function. The vascular endothelium, the lining of blood vessels, plays a crucial role in myocardial ischemia and atherosclerotic heart disease. While not all mechanisms of how psychological states and health impact cardiovascular health are understood, this study is a step toward defining such mechanisms. The study included participants aged 18 or older who were considered healthy, with no history of various cardiovascular and metabolic conditions, not taking any medications or supplements, and not currently smoking. The average age of participants was 26 years, with approximately equal gender representation and a diverse racial and ethnic composition. Participants' blood vessel health was assessed before and after completing emotional tasks using finger probes to detect changes in blood flow. Before the emotional tasks, participants relaxed for 30 minutes in a controlled environment. Blood pressure, heart rate, blood vessel dilation, and blood samples were measured before and after the tasks. The study found that recalling past events causing anger led to an impairment in blood vessel dilation, while tasks evoking anxiety and sadness did not show significant changes in blood vessel linings. However, the study's limitations include its focus on young and healthy participants, making it unclear if the results apply to older adults with health conditions. The study also only assessed short-term effects in a controlled setting, not real-world situations. Further research is needed to understand how emotions impact cardiovascular health and to identify interventions for those at risk of cardiovascular events. Thank you for joining. Please subscribe for more.